It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. Thank you so much for watching. I'm Dr. Alma Jenkins, and this is Health Tips. What are we going to talk about tonight? Well, before we get started, let me again invite you to let us know if you'd like us to come to your group, your church, your organization, and give a health topic. We'd love to do that. We love to empower you to take better care of your health. That's one thing. The second thing is, remember that we said if you have a healthy recipe that you want us to try on the show, just send it in to us. Be sure to give us your name, give us your contact number, okay, and your address. And you may be hearing from us because we would love to have some more recipes that you're actually making. It means so much when somebody sends something in and says, you know, this is delicious, we eat it all the time, blah, 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 blah. So let me invite you to send in your favorite healthy recipe or something that you've put together and you'd like us to air. We may end up asking you to come on the show and help us make that particular dish. So, you know, I'd look forward to hearing from you. And if you do feel the need or feel the urge to send your recipe in, remember that you may be getting a call to come on the show. All right? So tonight we're going to talk about something that we haven't talked about in a while, but we have talked about over these many shows, and that is alcoholism. This is the month of April, and it is the month for alcohol awareness. So we want to talk to you a little bit about alcoholism. Now, I'm going to give total credit to medicinenet.com because this is where I'm getting the information. They had some excellent slides, and I want to make sure that you see those slides, even if it's coming from another source. It's a reliable source, and so I think it's good that we share this tonight. How many of you know someone who's an alcoholic? Have you yourself struggled with alcoholism? It's a very difficult habit to break. I see patients with this problem all the time as a gastroenterologist. And this slide brings out some of the things that we're most concerned about that alcoholism affects in your body. So let's get started. Let's look at slide number 1. Alcohol consumption can cause serious and numerous problems. Many people know that heavy drinking can lead to cirrhosis of the liver and is a leading cause of automobile accidents. But did you know chronic drinking could also lead to cancer and heart attack? Let's look at the following slides. One of the health risks of chronic heavy drinking is anemia. Excessive alcohol can affect the hemorrhagic system or the hematologic system. That word should be hematologic system, which is made up of the blood, spleen, bone marrow, and the liver. It can cause your red blood cell count to be abnormally low, which is a condition called anemia. Symptoms of anemia include fatigue, shortness of breath, and lightheadedness. These are examples of your red blood cells. Cancer. Chronic alcohol drinking can increase your risk for developing cancer. The body converts the alcohol you drink into acetaldehyde, which is a known carcinogen. What is a carcinogen? That is a substance that causes cancer. Cancers often found in heavy drinkers include those of the mouth, pharynx, larynx or voice box, esophagus, liver, breast, and colorectal region. Many heavy drinkers also smoke, which increases their cancer risk. What about cardiovascular disease? Heavy drinking and binge drinking can cause heart disease or stroke because it can raise the levels of fats in the blood or triglycerides and lead to high blood pressure and stroke. It can also cause cardiomyopathy or weakening of the heart muscle and heart rhythm abnormalities, atrial and ventricular fibrillation. Cirrhosis. Many of us already know about that, and this is a picture of the liver here. Alcohol causes inflammation of the liver, and chronic drinking can cause scarring of the liver tissue. That leads to cirrhosis, a potentially fatal condition where the liver is so scarred it can no longer function. The risk increases the longer you have been drinking. Not all heavy drinkers will develop cirrhosis, though it seems to run in families, and women get it more often than men. Dementia. Heavy drinking can affect areas of the brain and lead to memory loss and some symptoms of dementia. This abuse of alcohol can cause alcohol dementia, which results in poor judgment and difficulty in decision making. Heavy alcohol drinking over a long period of time may result in Korsakoff syndrome, where people may suffer short-term memory loss. In addition, heavy drinking may result in nutritional deficiencies, which can also result in dementia symptoms. And what about depression? Alcohol abuse and depression are often associated. In some cases, people are depressed and turn to alcohol to self-medicate. However, a 2013 study showed that many people who drink heavily develop depression. Seizures. Heavy or binge drinking or alcohol withdrawal can lead to a form of epilepsy called status epilepticus, or an acute, prolonged epileptic seizure, which is a life-threatening condition. Excessive alcohol use can also trigger epilepsy in some people who did not have the condition before they started drinking. Some epilepsy medications may make you more sensitive to the effects of alcohol, and alcohol may interfere with some medications used to treat epilepsy. Some of you may know patients who have had a seizure when they were drinking, or even when they had stopped. What about gout? Gout is a type of arthritis caused by the formation of uric acid crystals in the joints. It can be very painful. Alcohol intake may increase the risk of developing gout, particularly in men. And beer seems to cause the condition more than other types of alcohol. If you already have gout, drinking alcohol may worsen your symptoms. And here's where those crystals are forming in between the joints there, causing great pain. High blood pressure. Alcohol can cause high blood pressure. The more alcohol a person drinks, the greater their risk for developing high blood pressure. Hypertension can become chronic and can lead to other medical conditions, including heart disease, stroke, and kidney disease. Now, interestingly enough, once a person gets cirrhosis and really bad liver disease, oftentimes they will have low blood pressure. So that condition can change, and later on, when you're deep into the disease, you can actually develop low blood pressure. Excessive alcohol use can weaken the immune system and make it easier for you to get infections. Chronic drinkers are more likely to contract diseases such as tuberculosis, pneumonia, HIV or AIDS, and sexually transmitted diseases, or STDs. STDs are a concern because heavy drinkers are also more likely to engage in risky sexual behaviors. Even binge drinking on one day can affect your body's ability to fight off infection for up to 24 hours. Did you know that? What about your nerves? I don't mean just getting on your nerves psychologically, but your actual nerve cells. Alcoholic neuropathy is a form of nerve damage caused by heavy drinking. The contribution of alcohol being toxic to nerve cells, combined with the poor nutrition that often accompanies alcohol abuse, is believed to cause this condition. Symptoms include numbness, tingling and pain, muscle weakness, usually in the extremities, loss of bladder or bowel control, impotence, diarrhea, nausea and vomiting, or constipation. These represent nerve cells. There's the nucleus of the nerve cell. This nerve is firing off here. So as you know, we communicate via our nerve cells to our bodies to tell our bodies what to do. And what about this one? Many of you know someone who's had this problem. Heavy drinking can lead to pancreatitis, which is a dangerous condition involving inflammation of the pancreas. Symptoms may include acute abdominal pain, nausea, and vomiting. Chronic pancreatitis from chronic drinking may lead to malabsorption of nutrients and diabetes. In summary, chronic heavy alcohol use can have many damaging effects on the body. Talk to your doctor about ways to cut down on your drinking or stop drinking entirely to reduce your chances of developing health complications from drinking. So let's go back over now what we said here in the diagram. 12 health risks of chronic heavy drinking: anemia, cancer, heart disease, cirrhosis, dementia, depression, seizures, gout, high blood pressure, infectious disease, nerve damage, pancreatitis. I wish that I could take your questions right now, because I know that you're developing some questions from this information. As a gastroenterologist, I often see these same symptoms in patients who come in who've had this problem with chronic drinking. And I hope that you'll take this information and give it to someone that you love who may have this problem. Let's go back one more second to cirrhosis. I want to say a word about that, because many of you had questions about cirrhosis that you wanted answered, and I'm going to try to think of the questions. What is cirrhosis again? And I hope you're seeing this picture of the liver. Cirrhosis is where the liver becomes so scarred. This may be the usual size of the liver, but after it gets scarred, it becomes smaller than this and kind of knotty looking, sort of with a little irregular surfaces as opposed to being a nice smooth liver. I don't know if you remember what a calf liver or a cow liver looks like, or a pig liver, because they all look very similar. Instead of that nice smooth liver, the very bloody smooth liver, what you would see is a liver that's got a lot of knots and irregular areas in it because it's all scarred up and drawn up. That's a cirrhotic liver. That's cirrhosis. Okay? So when a liver becomes cirrhotic, it is less functional. What does the liver do? The liver makes vitamin K, so we don't all bleed to death. So the liver makes vitamin K. That's number one. Number two, the liver also helps in making a protein that helps to keep our body in balance. By that I mean albumin, which is a molecule that helps to draw keep the fluid inside the vessels as opposed to the fluid being all over the place. So sometimes we'll see people who have cirrhosis who have big bellies because they're full of fluid and they have to go and get the fluid drawn off periodically. So you see, the liver is no small organ in terms of function. It also helps us metabolize medicines. So when you go to the doctor and you get a prescription and you take the pill, it's the liver that breaks it down so that your body can use it. So it's a busy organ. When we mess with the liver such that it doesn't function well, we are messing with our lives. Okay? And then I want to say an extra word about the pancreatitis because that is so common in this area. Let's look. Pancreatitis. And this is often how patients look when they come in, although, anybody who drinks heavily can get pancreatitis. That's all races and nationalities. And it affects the pancreas, which is located where he's pointing there, just below the chest in the midline. Most of the time is where patients complain of pain with pancreatitis, right in this area. The pancreas can become swollen, very painful. There are other things that can cause pancreatitis, but certainly alcohol is high on the list. The other thing that can cause pancreatitis are gallstones. So those are the two top reasons for having pancreatitis: gallstones and alcohol. So we look especially for those reasons when someone comes in with pancreatitis. Now there is an inherited form of pancreatitis as well. We don't see that very often, but there is such a thing. And the seizures. Sometimes you can get seizures after you have withdrawn from the alcohol. You're no longer drinking. Maybe you drank heavily 2 days ago and now you're trying to come off it or stop. You may get a withdrawal seizure, which is very scary to your loved ones. Okay, especially the first time that happens. Okay. Now the gout, many of you are already familiar with the fact that that can occur, more so with drinking. But I want to say a word about the dementia. None of us want to get to where we can't think. None of us want to be totally dependent on someone else for taking care of us if we can help it. But let me tell you, if you keep drinking, then one of the things that you put at risk is your thinking. Because certainly dementia can be a risk with heavy drinking. And even if you're not really demented per se, but when the liver fails to function well, it cannot detoxify the blood. That's the other thing it does. So then some toxins can build up in the blood system and cause you to have fuzzy thinking, become confused. And this can go on for some time until you're treated for it. So just keep that in mind. And that is a very alarming thing when a patient finds that they can hardly think. They're not aware of it until it's over. But then when they find out how they were, it's very disappointing. And sometimes for some patients, it's very frightening. We do have medication for that, but you don't want to put yourself in that position. Okay. So we've tried to say some things about alcoholism tonight, and I hope that you will share this information with someone that you know. And if you get a chance to repeat some of this to others who may not be able to watch the show tonight, or just pull it up on the internet. Remember that we're on dralmajenkins.com. If you go to that website, then you can download or pull up, it'll take you to YouTube. I'm sorry, you'll go to YouTube. There's a link there to take you to YouTube, and then you can place whatever shows you're interested in watching on YouTube, because they are being uploaded as we film them. So I hope that you'll enjoy that. Maybe you'll get a chance to catch up on a few shows that you may have had to miss. Okay? We're always glad when you tune in, whether it's late or whether you're just right on time. We understand your schedule's busy and you have many things to do, but we are excited about doing the show, and I'm very happy when you find the time to tune in to the show. So do that. And again, my credits, my shout out goes to medicinenet.com, which is the website that I'm using to pull this slideshow off, and I thank them for being able to use their slides. Now, you know what we want to do with the little time that we have left. And we're going to do some exercises without our cans. I'm going to tell you that you can do them with or without cans. So let's get started. We have about 5 minutes, and I want us to use that 5 minutes exercising. And then just before it's time to go, I'm going to recap a few things from this slideshow on alcoholism. So one of the first things you want to do when you're trying to exercise is just to stretch. Just let's stretch a little bit. You know, stretch. And that usually feels pretty good because you haven't had a chance to do it. Just stretch your arms up, and I want you to take a deep breath and let it out. Do that again and let it out. Okay? Because you know what? Some of you go all day and don't ever really take a good deep breath. You're just doing that shallow breathing. Take in a good deep breath. Give those lungs a lot of good oxygen. And that helps the whole body to get oxygenated. You know, it's like, if you're underwater, eventually you're going to want to come up and get some air. So let your body get a lot of nice fresh air. Okay? And you can do that taking a good deep breath in and letting that air get into the lungs. All right? Okay, let's do some boxing. 1, 2, ready, and 1, and 2, 3, and smile while you're doing it, and 4. You know, because it's a privilege to be able to do this. And 6, 7, and 8, and 9, and 10, 2, 3, 4, and 1, and 2, 3, and 4, 5, and 6. Are you doing this with me? Are you sitting on the couch? I want you to sit up in that chair and do these exercises with me, because these are just chair exercises. They're not that hard. They're not hard at all. Okay? Now let's combine this and do up and out and 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 up. Let's do 10. 1, and 2, 3, and 4, 5, and 6, 7, and 8, and 9, and 10. 2, 3, 4. Now I want to remind you of the things that we mentioned tonight that are a result of alcoholism and that are very harmful for you. Okay, we only have a few minutes, so let me go back to that summary. For those of you just tuning in, this is kind of a summary of what we said. Give me a second and I'll get it for you. I want you to see that particular slide if I can get back to it. And we have just jumped to a whole other slide, which is not what we wanted for you. So I'm not even going to bother you with that. This gets into anxiety, and that's not where we're going. But if you recall, we talked about the various things that can cause, the various problems that alcoholism can cause. And one of them was that we found that some forms of cancer can be related to underlying alcoholism: anemia, hypertension, gout, dementia, okay, to name some, pancreatitis, cirrhosis, okay. So these are some of the things that we brought up tonight that are a result or that can stem from the problem of alcoholism. It's a very difficult habit to break, and I'm sure you probably know someone who has a drinking problem if you don't have one yourself. So what I want you to do tonight is I want you, if you have the problem of alcoholism, I want you to get some help. I want you to confide in a friend, someone that you trust, someone that has your best interest at heart. And I want the two of you to explore ways that you can get help for your alcoholism. AA is one place that you can go. But see your doctor also to see what kind of shape you're in as far as your health. And then talk to your doctor and see what help is out there for you. Okay? Unless you acknowledge it, you can't beat it. So let me encourage you to get some help tonight. And if you have a loved one or a friend who has this problem, reach out to them. Take that risk. I know they may get upset at first. They may push you away, but try. Try. So, thank you so much for watching tonight, ladies and gentlemen. It's been my pleasure to bring you tonight alcoholism. This is the month of April. This is the month for alcohol awareness, and there are some other things that April is known for as well, but we're going to capitalize tonight on alcoholism, a very common problem. And remember that we said the liver does a number of things, so you want to preserve that as best you can. Ladies and gentlemen, thank you for watching. Good night.